This is the position we get the patient in before we intubate. So we try to flex at the lower cervical spine, so down at C6, 7, flex forward, and then extend at C1, 2. And this is known as the sniffing position. And you have to adjust that pillow under the head, sometimes underneath the shoulders, to lift the shoulders to improve the extension to get a good airway. You should always have something under the head. One of the fallacies of people who don't intubate frequently is that they throw the pillow across the room to get it out of the room, and then an anesthesiologist has to come in and put it back and intubate the patient. The laryngoscope is placed on the right side of the mouth, avoiding touching the teeth. It pulls the tongue to the midline and it's lifted. It's never, ever do you turn your wrist when you're doing this. You put the laryngoscope in and you lift. And the lifting lifts the tongue and the mandible and allows the cords to be seen. And you can see in this example, the cords are very easy to see. And that's a dream intubation. That's going to be very easy to do. So in this situation, you can see how difficult you can make things by positioning the patient incorrectly. In the picture on the left, the patient doesn't have a pillow. And I just finished mentioning how important that is, but you can see what's happened here is the neck's too flexed. The lower part of the neck is kind of pushed forward and you can't get good atlanto-occipital extension. In the second picture, it's better. There should be a fairly straight line from the mouth down the airway. You can see in the third picture, there's a fairly good view, but it could be argued that this is too extended, that they've extended the whole neck rather than just the atlanto-occipital area. So the Macintosh blade, the curved blade, should be positioned anterior to the epiglottis in the vallecula, that's the base of the tongue, and should not contact the epiglottis. The Miller blade, the straight blade, on the other hand, actually lifts the epiglottis, and you can see that in the picture to the right of the Macintosh blade. It actually lifts the epiglottis, and there's some hemodynamic changes that can occur when you do that, particularly vagal stimulation, so you can get bradycardia and things that I'd just as soon avoid, so I don't use a straight blade.
You just completed your first video of the world's best medical exam preparation. Lecturio brings the knowledge of worldwide leading medical experts and teaching award winners to your PC, tablet, or smartphone. Prepare yourself and check your progress with thousands of quiz questions customized to USMLE standards. And the very best, you can get in touch with our medical experts personally. Visit lecturio.com now and continue with the most inspiring medical education around the globe, anytime, anywhere.